Hello, my name is Dr. J.T. Michalski. I'm here to talk to you about your son's recent genetic testing. He tested positive for cystic fibrosis. Cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. Some symptoms include salty tasting skin, persistent coughing, sometimes with phlegm, frequent lung infections such as bronchitis or pneumonia, poor growth even with a large appetite, and finally, difficulty with bowel movements.
As per Dr. Muzalski's recommendation, I would like to thank you for meeting with me. Being a genetics counselor, I help my patients understand the science behind the diseases they are facing. Cystic fibrosis is a non-sexual recessive trait that is only expressed when both parents pass down the recessive allele of that gene to their offspring. Recessive alleles are the trait that is less common when expressed in a gene. 1 in 2,500 to 3,500 people are diagnosed with this disease. For African Americans, the probability is 1 in 17,000 and 1 in 31,000 for Asian Americans. Most people with CF are diagnosed at the age of 18 or higher. I hope with this information you are better prepared with what lies ahead for your son. I'd like you to come back in a week's time to learn more about the molecular science related to this disease. This will be done with an analysis of both your specific DNAs and reported to me by Dr. Joshi. I'd like to thank you for coming back in to take a further look at what cystic fibrosis is. With me here today is Dr. Joshi. He will give you a closer look at the ins and outs of this disease.
Hello, my name is Dr. Joshi. I'm a molecular scientist, which means I will be explaining how your son got cystic fibrosis through a molecular lens. Cystic fibrosis is a genetic disorder. This means that it is the result of genes that are not working correctly. Cystic fibrosis is controlled by a mutation on the CFTR gene. Specifically, it is caused by a deletion. A deletion is a mutation where a specific DNA base is eliminated. This causes a reading frame effect, in which DNA bases that follow the missing base are all offset. This might sound like a minute detail, but it can have a large outcome. CFTR is normally is a gene on chromosome 7 that provides instructions for making channels that transport chloride ions in and out of cells. People with CF don't have a fully functioning CFTR gene, which results in thick and sticky mucus. This can lead to blockage, inflammation, and have serious life-threatening outcomes.
To better understand this, I have drawn a pedigree and Punnett square, visual aids that will allow you to see the outcomes of your specific case.
The drawing you are seeing is a pedigree. A pedigree is a diagram that shows the various outcomes of a specific allele combination within the parents. For your case, we found that both of you were carriers for the CFTR gene. As a result, we were able to conclude the different phenotypes of your potential offspring. By taking a look at the key in the top left, we were able to identify your son as the filled-in square. This combination of alleles occurred when both of you passed down the recessive allele, an unfortunate outcome. Similar to the pedigree, the Punnett square shows the potential outcomes of your offspring. In contrast, though, the Punnett square shows genotypes rather than phenotypes, a somewhat harder to understand visual aid. In the Punnett square, we are able to see in the top left that a capital C stands for the dominant allele, while a small c stands for the recessive allele. A Punnett square is displayed with the parent genotypes on the top and left of the outside box. We then create this offspring genotype by taking one allele from each parent by either taking from the top or left of the Punnett square. In the end, we get four combinations of homozygous dominant, combination of two big C's, heterozygous, one big C and one small c, or homozygous recessive, combination of two small c's. Respectively, we find the probabilities to be 25, 50, and 25% each. In the end, we've been able to conclude the inheritance and likelihood of your son's disease. I'd like you to meet with Dr. Muzalski again to learn about the treatments and better opportunities your son has for his future.
In severe cases, a lung transplant may be beneficial. However, there are downsides to this option. For instance, expense is one downside. In addition, complications may also factor into the patient's life after the surgery. A physiotherapist can also give you many tips and techniques to help your active cycle of breathing. Antibiotics can also be used to prevent and treat chest infections. A medicine called Invacaftor can help reduce the levels of mucus in the body. Although this is only suitable for fewer than 1 in every 20 people with cystic fibrosis. Another medicine called bronchodilators are used to widen the airways and help make breathing easier. Finally, steroid medication can be used to treat growths within the nose. Thank you for meeting with me. I'm glad that you now have a better understanding of your son's condition, and I'm glad we could diagnose it at such an early stage. Please contact me with any further questions.